So today I'm going to show you how a clinical setting in the US is going to look like. So when you walk in, you will see 3 sets of gloves: large, medium, and small. So it depends on what you are comfortable with. You can pick whatever gloves you want. And for the faucet, this is how the faucet looks like. Sometimes they have a tap, sometimes it's automatic. As long as you swing your hands, the water is going to run. So when you are going to do the physical examination, you're going to wash your hands. If you choose to wash your hands, take some soap and then you can turn on the water. Good. And this is how the paper towel is going to come out. Sometimes they might have the paper towel sitting right here. You can take the paper towel, or sometimes it's an automatic dispenser which is going to push the paper towel out. And they will have a trash. So this is how it is. And every setting will have a stool inside the room. So whatever you're comfortable with, when you walk in, talk to the patient, tell them you're going to take some notes, and if you feel comfortable sitting, just tell them, oh, I'm going to take some notes, do you mind if I sit and talk? Or if you don't want to sit, just tell them I'm going to take some notes, so you don't have to say anything. And come on here, I'm going to show you how the otoscope and the lights look like. So this is to look for your pupillary reflex. So always, whenever you pick it out, the light automatically turns on. If it is not on, then you can turn it around and it will dim the lights, brighten the lights. Okay? So always check if the light is on. And when you are checking on someone, move the light from the side towards the center. From the side towards the center. I'm going to show you this in a different video. So this is how the light looks like. This is for your pupillary action, if the pupil is going to constrict with the light. So whenever this is a fundoscope, whenever you have someone with a diabetic patient, then you have to look at their eyes. So whenever you pick it out, always check if the light is on. Okay? And once you have the light on, you tell the patient, oh, I'm going to look inside your eyes. I'm going to have to come very close to you. So just bear with me. And then just look inside the eyes like this and like this. Okay? So, and this is a blood pressure cuff. Usually it is always attached to the wall. And they will provide you with one standard cuff size. Here they have 2 standard cuff sizes. One is for the kids and one is for the adults. So they will only have one. If you decide to take the blood pressure while you're in the room, you can use this. And another thing is, whenever you use this to check someone's ear, you always need to use one of these covers. Okay? So the covers will just pop out like this. So one more time, it just pops out like this, and when you fit it in, you just put it in and kind of turn it a little bit, and then it's tight. So whenever you look inside the ear, just tell them you're going to pull the ear, it might hurt, and then look inside and repeat the same thing on the other ear. And once you're done, take it out and throw it in the trash. So in a clinical skills setting, they will have, like I said earlier, they will have paper towels, they would have your neuro hammer sitting right here, they would have your cotton, as well as toothpicks, and everything. They would have it right here on the table. And just whatever you decide to use, you can just pick it up, and you make sure you explain the patient what you're going to do with it. Because a patient might never know what a neuro hammer looks like. You tell them, this is a hammer, I'm going to hit you. No. What you're going to do is take a neuro hammer and tell them, okay, this is a neuro hammer. Just show them, this is not going to hurt. I'm going to check your reflex with it. Okay? And what else do we have in the room? That's pretty much it. And one more thing. About the bed, all the standard beds are going to look like this, with the paper in here. When you walk in, the patient will be sitting. And if you want the patient to lie down, you just reach your hand down here and you can pull this, push it back. Pull this so that they can put their legs when they are lying down. so that they are more comfortable. Okay? And this thing can go inside and can pull out. So you don't need to mess with it, because most of the patients, when they're sitting, they will be sitting like this. So you don't need to play with that. But if you want the patient to lie down, you pull this out, and then the patient can lie down. Okay. And that's pretty much it.